Today we have with us Mona. Thank you so much for joining us. You're an inspiration for so many. In fact, you've been living with HIV for 23 years. Tell us, Mona, what change do you see in the last 23 years, whether it's from the stigma then to treatment and access?
Yes, Ambika, there are a lot of changes because when I diagnosed in 90s, so that time the HIV was not well known. The known factor was AIDS, AIDS equal to death. So that was the statement very popularized in general community as well as healthcare providers. So if we say now the terminology and the friendship with the HIV become and adapt by the public in general. So now the people knows what is HIV, how it spreads, how it doesn't spreads. And how we can avoid the situation of AIDS. So there are certainly a lot of change through the information, education, communication materials and through the NSCP programs which initiated since NSCP 1. So I think there is a lot of change in terms of awareness, in terms of health services, in terms of expansion of the treatment centers, in terms of community friendly services. But still, there are a lot of
gaps
things,
which
needs to filled up by the community ownership.
Mona, how important is it to address the stigma as well as strengthen the community support system? We've spoken about what all should be done. What are your thoughts on this?
See, when we talk about the stigma, so if a person living with HIV, there is a big fear due to the self-stigma.
Yeah.
So the self-acceptance is must. So, if anyone newly diagnosed with HIV, how they get the self-acceptance? When they will feel enabling environment in family, friends and surroundings. So, that environment building where we needs to contribute being a community. And while I am saying community, it doesn't mean only PLHIV community, community as a whole, which includes all the society support.
Yeah.
From the birthplace of the family to the institution, accommodation and the occupational places. So I think it's a vast range to have the allies at every level to address the stigma as well as to respond that. So that integration is making a big place to address that stigma.
So integration is